you wouldn't go on holiday without preparing. You wouldn't go without travel insurance or sun cream or anything else. You wouldn't do things without preparing. So why are we so reluctant to prepare for something that we know is going to happen?
Hello and welcome to the Brief Conversations podcast from Napthans. My name is Charlotte Cooper. I'm a Senior Associate Solicitor at Napthans LLP and I head up the probate team in the Wills and Estate Planning Department. I'm delighted to welcome my colleague, Farida Isaji, solicitor in our Wills and Estate Planning, specialising in will drafting for our clients, and Devon Park, legacy fundraiser at Trinity Hospice. And we're here to talk about a slightly taboo subject: why don't we talk about death? So Farida, in your experience, obviously you're discussing with clients when they are considering this, but in a very legal sense. How do you find people talk about death in your experience?
I think in terms of whilst doing this as a job and seeing clients in the office setting, you can get a lot of clients who are quite nervous when they first meet us. You find that it's about the fear of the unknown, tempting fate, and people just don't want to think about dying really. And because I prepare wills, which is a document which is dealt with after life, it's almost like they have to think about it. It pushes them to think about it. And I feel that, people are too busy in their lives, that, they have children, aging parents, and almost because we're conditioned to live and not to really think about die, we almost feel, we're all immortal. People tend to, when they come in, you can see that are hesitant to kind of talk through what they would want to do once they had passed away. But for us as legal professionals, it's so important that they do that because it's their legacy, it's what they're leaving behind. And if they don't deal with it, there are lots of consequences after, unfortunately, that they do go, which, yes, in a legal setting can be very complex, but can also be overly burdensome for the family because things haven't been set out as they may have wished. And I think some people see dying as a negative thing. Sometimes, we use this sort of terms, they've lost that battle. Sometimes sort of all the negatives that go with that. But it's really just preparing for the life stages, and it's a cycle of life.
From when I was will drafting, it was quite odd because people could be keen to talk about legalities. So-and-so will have my house, my jewellery, etc. But they didn't talk about the relationships they left behind.
Yeah.
But in my experience dealing with the aftermath, that's what all comes to the fore. If there's any historical family problems, it all comes up, which is why personally I would encourage people to have conversations about when I go, this is what I want to happen. Devon, in your role, this must come up all the time because you speak to family members who are sadly watching a relative in an end-of-life stage. What are the conversations that you're having and do they sort of talk in that sense about death?
Obviously, being from the hospice, we do sort of deal with people at the end of their life. So whether that's a time that you should be thinking about what you want to do, where you want to leave your belongings and things like that. So we do find that people have those conversations, and sometimes they're in a really stressful situation. So it is rushed. Or people don't want to speak about it because they're going through a really emotional time. However, what we try to encourage at the hospice is you do talk about it sort of sooner rather than later, to stop the patient feeling isolated, because they know what's happening, you know what's happening. However, they're going to feel that they need to get their things in order. So we do encourage it as much as we can because it isn't something that anybody likes to talk about, as we've already mentioned. But it is something that we see every day. But yeah, coming from obviously a legacy side, I deal with quite a lot of admin of the legacies and things like that, and it's amazing to see how many changes are done and how many amendments are done, and it's usually in those last sort of weeks and months of people's lives because they don't want to think about it before then.
Yeah, I would definitely echo talking about it sooner rather than later, and in a non-emotional time when you can have really a family discussion, and really making your will should sort of be the last stage of that, shouldn't it? But rarely happens. How do you think people could talk more about death, Farida?
It does depend on sometimes your background. Coming from a faith background, I find that as a Muslim, we prepare for the afterlife, and that's based on spirituality and religion, that actually this life is a journey for the afterlife. But obviously not everyone does believe in the afterlife, and that's fine. But as I mentioned before, I think it's just seeing it as a natural part of the cycle of life, and therefore having these open and honest discussions. I think we just mentioned before about preparing when you're doing your will. It's even talking about your funeral wishes, about how you would like that send off, really, because that's the closure, isn't it? It's for your family and friends to say goodbye to you.
Yes.
And lots of people do put in their wills about, so many people are concerned about the environment now that they actually are quite specific about having environmentally friendly funerals. But if you're a person who has those type of wishes and you've not let anyone know, those wishes won't be carried out. And that's about the conversation. It's about us being open and honest with our family members and those people close to us, especially, Devon, you see in your line of work where death is probably imminent and they know it's going to happen. So it's you said about isolation. It's about you as a family and you talking to people and saying, I know I'm eventually going to go, and this is what I would like to happen. And almost it could bring a comfort to them that everyone's put at ease that it's time to say goodbye, because I think one of the things we all know is that we are all going to die. That's the only fact that we know about life. And I think for me, I think having a conversation from very early on, perhaps, that, even if people have grandparents, and kind of saying, oh, they're a star, with kids, however you want to use it, they're a star in the sky, or whatever tool you want to use to say, people do go from this life, but that's fine.
It would be sort of a much more emotionally healthy way of dealing with it. I'm always surprised when clients ring and say, my mum, my dad has passed away. They're absolutely desperate to do things exactly as their late relative would have wished. So their first question is always, are there funeral wishes? And there is a relief when there is a will. But we also encourage clients to write letter of wishes that may state things that aren't legalities, but I've had clients who say, use this money, go on holiday, you've always wanted to do that. And that gives a lot of comfort. And family are just desperate to comply with the wishes of the deceased. Do you find that, Devon?
Yes, I wanted to just touch back on something that you mentioned before, in relation to obviously speaking to children about passing that they may have experienced, and sort of talking to children from a young age. We have a service at Trinity called the Linden Centre. Now that is a counselling service, and we do see quite a lot of children that may have experienced a loss of a parent or a grandparent, and sometimes that's not the first time that they've experienced death. It could be of a pet, so maybe introduce it at that point. But what we find is that our counsellors speak to children and they ask, do you know what happened to mummy or daddy, or do you know what happened to grandma? And they go, yeah, they fell asleep. And that's something we're trying to sort of remove and sort of say this isn't how we should sort of tell younger people what's happened, because are they then going to be scared to go to sleep? And we want you to be open and honest about everything that's happening in the journey that you're going through. And I think we are starting from the younger people, so I just wanted to touch upon that, because we are trying to sort of educate younger people right from the first minutes that they come through the doors.
I mean, I find irrespective of age group, people are just very reluctant to talk about death. And I wonder, how do you think we could encourage people to change that behaviour? Do you think, Devon, that it's just starting at a young age, having conversations in family?
I think it is our culture, and us in the UK, we do shy away from talking about that. And from personal experience, I think that the earlier that you do talk about it, it's easier to accept when it happens. And having those conversations, you do feel slightly more relieved. and it does let you, even though it's really difficult at the beginning to talk about maybe death or dying, you do feel a lot more sort of comfort that you've spoke about this, and you're prepared, and you know. You wouldn't go on holiday without preparing. You wouldn't go without travel insurance or sun cream or anything else. You wouldn't do things without preparing. So why are we so reluctant to prepare for something that we know is going to happen?
And in those cases where they have spoken about deaths, sadly it is when they've had a terminal diagnosis and they come to us to make a will. It is a slightly different conversation, isn't it, Farida?
Yes, it's very matter of fact a lot of the time, but also you feel that people are generally more relaxed and accepting of the situation, that ultimately they won't be here. And we do see ourselves people who are being terminally diagnosed. A lot of them don't know in terms of what timescale they have, but they know, it's not going to be very long. And I feel that when we see those type of clients, that they very much want to make sure that the people that they leave behind are looked after, and know that the person who is leaving, whether it be assets, whatever kind of, whether it's a house or specific things, that it's because they, that they want to leave a legacy for them behind. And I feel that it's just as important whether, you've been diagnosed with something or not, that you prepare. Like you said, it's so important, because preparation is...
It's important really at any age, isn't it? I have young children, so sadly you do have to consider what would happen in the awful scenario that something happened to me and my other half, and have that conversation with my wider family so that they know what my wishes would be. Very difficult to have, but and quite emotionally draining, but at the end of it I do have a feeling of reassurance and comfort for myself.
That peace of mind, because I think in your situation, you would want to ensure that your children are looked after by people, that you've chosen.
Yes, and who know what I want for the children. And
hence the letter of wishes. I mean, lots of people now, parents, a lot of people think, we don't need to make our wills until we're in our 50s, 60s. But actually, something happened to you whilst you were young. How do you want your children to be brought up? It's not just about the legalities, about the guardianship of those children, but also writing a letter of wishes. I've had clients who have wrote quite lengthy letter of wishes saying, this is the values we'd like to instill in our child, and this is how we would like them to be brought up. And I think that is just as important to ensure, and hopefully it would never happen, but unfortunately if children are left bereaved in their minority, then at least they are brought up as far as can be as their parents would have wanted.
It can strangely be an easier conversation to start rather than right, do you want my house? People think they're being a bit mercenary and say, oh, mum, dad, I don't want to talk about that. So Devon, how do you sort of encourage adults, we've spoken about children, but how do you encourage adults to talk more about death within the family?
I think obviously we have families coming into us, so we're at that very end stage, and sort of from a hospice point of view, we're just there to sort of be that emotional shoulder, and sort of to encourage everybody to talk about it while they can. It isn't something that I can sort of answer from sort of a clinical side of what the nurses do and how maybe they would speak to patients or speak to adults in relation to how they think they should speak to their families. But you will find that adults, they have very different views, and that's going back to isolation of the patient. It is a case of they want to talk about it, but their family don't. And we do try and encourage that, even though it will be really upsetting and emotional for you, you need to do this. It is something that you need to have that conversation with whoever it is that we're looking after. And we do try and take away the sort of emotional side for the adults maybe that aren't in our care, more to think about maybe the needs of the patient and how they want to feel before obviously what's going to happen.
As often for us it's the reverse. We see our client in private and they may be happy to talk about it one-to-one, but a number of times when you see them again, they haven't gone home and spoken to their family about it. And the number of clients who have appointed somebody an executor and never told that person.
I see that when dealing with the estate.
Yes, and again it's that reluctance to talk about the responsibility that sadly comes when somebody has passed away.
I mean, a will is a confidential document, and they, of course, they don't have to talk to anyone about their will, but in a normal family setup where we there's not going to be any contentions, I think it's so important just to get the conversation started. I think we've all took away that communication is key. And probably from an early start.
So thank you to Farida and Devon, and thank you to you for listening to the Brief Conversations podcast, and we hope this encourages you to go home and have those private, meaningful conversations with your family. Thank you.